claiming. There are three different ways in which you can claim. And I've kind of organized them in terms of how convenient it is, from the most convenient to the least convenient, I would say. So for me, the most convenient is the Pay Direct card. The Pay Direct card is the most convenient because when you go to a point of service, you can just show them this card and your practitioner or your provider is able to direct bill you at that point of service. This means that you won't have to actually incur the cost and then have to go claim with the mobile app or by sending an online form. So the Pay Direct card is for me the most convenient way for you to have your claims processed at the point of service. Now, one very special thing that Desjardins has done starting from now, this fall semester, is that they have increased the amount of service points that you can actually get direct billed at. So prior to the fall semester, we used to be able to just get your direct bill happening at the pharmacy and at the dental office. However, now Desjardins has expanded their system so that you can have your claims directly billed for physiotherapy, for things like podiatry and so on and so forth. So please go on the website, download the new Pay Direct card. My colleague Ali will be putting the link in the chat box as well, as this Pay Direct card is what you will require to actually show to your practitioner so they can direct you at that point of service. Secondly, we have the mobile app. The mobile app is called the Studentcare mobile app, and it's available for free on the App Store and the Play Store if you use an Apple device or an Android device respectively. So it's very, very good. It's also very convenient to use because all you really need to do is take a picture of your receipt and all the supporting documents with your claim and send it directly to the insurer. They will receive that claim, they will process the claim and send you a reimbursement in the form of a direct deposit or a check, depending on which option you choose on the mobile app. So that's for me the second most convenient way of claiming as well. The third most convenient way, the reason why I say most convenient is because it's not inconvenient, it's just relatively inconvenient to the other two that I mentioned earlier, the online forms. We have the online forms, the health and dental forms on our website, studentcare.ca. You can always go on the website. Ali will also be dropping links to the online forms as well. If you're more, old-fashioned and you want to kind of submit claims by paper, you can always download the forms, attach your receipts and all the relevant information about your claim and send it directly to Desjardins, your insurer. They'll receive this claim and they will also reimburse you in form of direct deposit or via check, depending on what option that you pick. So the deadline is also a very, very important thing to note for all students. Deadlines for claims are 12 months from the date of service. So when you do incur a service, for example, if you go see a physiotherapist on the 3rd of September 2021, please ensure that Desjardins receives that claim and all the relevant information with that claim by the 3rd of September 2022. So you have 12 months to get that claim to them. We advise that you send that claim a bit earlier, maybe about 2 weeks earlier, so that Desjardins has ample time to receive that, taking into consideration kind of the post-mailing times or whichever courier service that you use. Now, student care networks. Student care networks are something I really like to touch on a bit more because I know students kind of get confused as to whether they'll get covered if they go to somebody who is not part of the student care network. Just to clarify, the networks are a group of exclusive providers that we partner with to give our GSA members an additional discount on top of the insured portion of the plan already. So this is not to say that you won't get covered if you go to a practitioner that you're more used to or more accustomed to. These networks, these providers are just a list of exclusive partners that will offer you that extra discount. So for example, I like to use the dental portion of the plan as a very good example of how the networks work. If you go see any practitioner, for example, any licensed and registered dental practitioner, and you go have a cleaning done, you will get 70% worth of coverage under the GSA health and dental plan, regardless of whoever you go to. However, when you go to a network partner, you can get another 30% in discount. So in network discount, which is really, really good. And it gives you that extra buffer financially. So in this case, you get 100% coverage. Whereas when you go and get that same service done for the member who is not part of our network, you do not get that. You do not get that extra 30%. So this is all subject to the $850 dental annual maximum. So please also have that at the back of your mind as well. However, this is how the networks work. So that's how I usually like to explain the student care dental network. So please don't think that you won't be able to get covered if you go to any licensed or registered dentist. The networks are just an exclusive list that we partner with to offer our lovely GSA members an extra discount. So that's the end of the presentation today. If you would like to contact us even after this, you can contact our direct line. I have it on my screen here, 825-205-9873. We're available from Monday to Friday, 9 a.m. to 8 p.m. every weekday. You can also go on our website, studentcare.ca, and hit the contact us link at the bottom of the page. You can send us a an email just to inquire further about certain parts of your plan, and an agent will definitely be able to help you. So this is the end of the presentation. If you have any questions, please drop them in the chat box. Please use the raise hand feature and we can answer every question that you have.
Thanks so much, Wei. I see Parisa has her hands up. Would you like to ask your question?
Yeah, thank you, Mary. Can you hear me?
Yes, I can hear you.
Okay, well, I have one question. So my dental and health plan is right now under my husband's. I live in Ontario and I want to like opt out from that plan and be under the university OHIP. So I wonder if it's covering all of the dental and health plan that I already have. So
yes.
Because I live in Ontario and I want to stay for fall semester and I don't want to move to Calgary right now.
Right. So sorry, just to understand, you have dental coverage under your husband's plan, and you would like to opt out of the GSA dental plan, I believe.
I want to update from that one, and I want to be under the GSA from the university.
Okay. So you should already be billed the plan fees in your tuition fee statement. I'm not sure as to how to opt out of the one from your husband. I believe you'd have to ask your husband's plan and the providers of your husband's plan. However, you do have the coverage under the GSA health and dental plan. Just verify on your tuition fee statement. It should say the GSA health plan and the dental plan. So to opt out of that plan, you'd have to ask their provider how to go about that. If you do want to also combine your benefits, please note that that's also an option. You can combine your benefits to get a maximized coverage under both plans, if that's another option. I hope that answers your question, Parisa.
Yes, so I want to know the coverage. Is this the same in Ontario? Because I want to use it in Ontario, not in Calgary.
Oh, okay. My colleague Ali will drop a link to the dental portion of the GSA health and dental plan, and then you can just kind of review that plan and see if it kind of covers the same things or very similar things as the one under your husband's plan as well. So you can decide whether you wanted to keep both of them or whether you wanted to opt out of this one or the one under your husband's plan.
So suppose that if I want to like opt out from that one and get the university's plan. Yeah. Is this support both health and dental?
Yes.
Ontario.
Yes. So you can access this plan in whatever province that you are in Canada. So whether you're in Calgary, whether you're in Ontario or BC, you can still get access to the GSA health and dental plan. So we do have a list of networks everywhere, ranging from Saskatchewan to Montreal to Quebec. So please note that you can access the health and dental benefits wherever you may be in Canada.
Thank you so much. So I have just one question. Sorry. Yeah. So what's the seal of the coverage? I mean, in terms of dollar. So, for example, if I want to have a dental treatment up to like 600, is it cover everything, or is the percentage that is covered?
So the dental portion of the plan has an annual maximum of $850 every year. So between September 1st, 2021 and August 31st, 2022, you have an $850 cap. So everything will be subject to that. So if you go for a cleaning that covers you for 70%, you will only be covered 70% for that particular service, and that amount will be deducted from your $850 annual maximum. So regardless of how many dental services that you incur within the policy year, just know that you have that $850 cap.
And it's for dental. And what's the like maximum for health plan?
There is no maximum for health in general. Every subsection of the health coverage has its own maximum. My colleague Ali here will put that link in the chat box so you can see You can see the prescription drug maximum if there is one, and you can see for the practitioner coverage as well. So there's they're very different maximums depending on what kind of service that you're going for. So the mental health practitioners have a maximum of about $325, I believe. And then you also have different maximums for vaccinations and for prescription drugs as well. So yes, my colleague Ali will share a file in the chat box, so you can revisit for sure.
Thank you. Thank you.
No worries, Teresa. Juliana?
Can you hear me okay?
It's a little bit light.
Okay, is that better?
Okay, I can hear you, yes.
Okay, I'm just wondering, where do we find the dates for opt-out periods for different students? So I'm a May student.
Yes.
But I didn't get an email or anything about an opt-out period for the May portion. So I'm wondering, where would I go to find that for next year if I want to opt out?
Okay, for next year, we do have all of the opt-out dates from September, for the January period, for the May period, and the July period on our website, studentcare.ca. If you go on studentcare.ca, there is an opt-out section just at the bottom right of that page. So when you click on that page, you see the change of coverage period, and it gives you the coverage periods for all the 4 different intake periods. So my colleague Ali will also drop that link in the chat box as well. So please just look out, and then you can see the change of coverage period that aligns with your intake period.
Okay, thank you.
No worries. Yeah. Atika?
Hi.
Hi.
Can you hear me okay?
Yes, I can hear you.
Okay, perfect. So I just have a question about students who are from Canada, specifically from Ontario,
Yes.
who have an OHIP. I was wondering if the OHIP works as a means of obtaining healthcare instead of getting, I guess, the Alberta specific card.
Yes. So that's correct. So for Canadian students, any provincial health coverage that you have will serve as your basic provincial coverage. So you don't necessarily need to switch from your OHIP to the ACIP in Alberta, unless there's certain services that you would incur that require you to switch over. But I don't believe that you'll be required to switch over from your OHIP. So if you do have your Ontario provincial coverage, that should still work perfectly in conjunction with the health and dental plan. So you're not required under the plan. I can attest to that. You're not required to switch from OHIP to ACIP, because you can just use your provincial coverage from Ontario.
Okay, perfect. Thank you so much.
No worries. Glennis, hi.
Yes, good morning.
Good morning.
I just had a question about I'm wanting to go into the health and dental plan for the year, but if my studies are completed by, say, the winter semester or spring semester, does it still go to the end of August, even though I'm no longer a student, I've graduated?
Yes, that's one of the great benefits of the GSA health and dental plan. For students who finish their studies at any point during the policy year, the plan will still cover you until the end of that policy year. So you're billed for coverage from September all the way to August 31st, 2022. So if you finish in January or February or even December, the plan will still cover you all the way until the end of August. So you will still have access to the benefits.
Oh, excellent. Thank you very much.
No worries, Glennis. Hi, Marianne.
Hello. I'm the one that's been giving you a hard time about the changes on May 1. Because of that, I just like to seek some more clarification on this.
Yes.
So I guess I have 2 questions.
Right.
One is, why did the GSA decide to make that decision? And I haven't been able to find any side-by-side comparisons really about what's been taken away versus what's been added.
Okay.
And on that note, I did speak to some people at the pharmacy, and they were also upset with the changes because they feel like it actually doesn't benefit more students. So I want to hear the GSA's rationale. Okay. That's question 1. And question 2 is just to seek some further clarification about really what the 2 differences in the exception or exemption processes are. We've got one as prior authorization drugs and one as not listed as prior authorization So I just want to hear a bit more about that too.
Okay. So prior to May 1st, 2021, I'm actually glad I'm getting to speak to you, like,
I know. We've been having a bit of a back and forth email banter.
No, it's great. So prior to May 1st, 2021, the GSA plan was centered around a very specific list of medications. So this was not in accordance to what the Alberta drug formulary is. So it was just a very specific one. So you had certain things like, like certain IUDs, some contraceptive pills as well, some medications that were covered under that particular list, which was great. However, we switched it to the Alberta drug formulary because it was more streamlined with all the other plans across Alberta, and it covered more medications automatically. I know in your case you had some medications that were covered before automatically, and then were taken off and they weren't covered, which is really, really unfortunate. I'm really, really sorry about that.
Two of them, my only two, both got taken off.
No, I'm so sorry. I realized that some students would definitely kind of bear the brunt of that. However, we do have the exception process, which does help to cover these medications. So the only difference is, whereas before you'd be able to kind of get that covered automatically at the pharmacy, now you actually have to apply for an exception process. The two differences is that one is the prior authorization. The prior authorization one, if it's listed as a prior authorization drug by the insurer Desjardins, it has to be applied directly through Desjardins. So you have to get the form and fill it out and apply straight to Desjardins. They will process this and then reimburse you directly. Whereas the drug exception process goes through Studentcare. So depending on where you're from in Canada, if you're an Alberta resident, you can apply with the Alberta drug exception form. And if you're a non-Alberta resident, you can apply with a non-Alberta resident form as well. I think Ali will just drop the links to the EDS process below, and we'll talk about it a lot more in our email thread as well, Marianne.
Okay.
I'll tell you the whole process and how to go about it, but it's not very, very hard, and I can always take handle the process for you as well. So it's just to kind of to get it covered in a different way that's not really the Alberta drug formulary. That if you're not getting it covered directly, the drug exception process is just in place to make sure that like those medications, you can still get access to them. We do have some exceptions for medications that are not covered under the drug exception process. However, with most medications, you can actually get them covered under the drug exception process. It's just a little bit of a hassle because now you have to actually apply differently, whereas it was covered before. But I assure you that most medications are now being covered under the Alberta drug list. I'm sure you're one of like the unfortunate cases.
I'm the squeaky wheel because I've had something taken away, and people who get things added aren't going to congratulate you. So this is how the world works. It's like
I know.
Loop. Okay.
I know. I'm really, really sorry, but just be rest assured that we'll definitely support you in the whole exception process, and we'll see to it that your medications do get covered under the plan.
Okay, and just further little question, and that has to be renewed every 12 months.
Yes.
Right.
But the thing is, when you do it once, the rest of the processes get very, very easy. So you just have to kind of fill out the same form within 90 days of its expiring, and just send it back to the same email address. We process it for you. So before it even expires, you can apply for it again, and then it just kind of just rolls over to the next year. So every 12 months you have to apply for it, just because obviously like the plan works in a way where you can't have an exception drug kind of covered for the whole duration of the time that you're covered under the plan, which is a little bit unfortunate, but it's just to kind of avoid certain things like there's certain medication that you can get just specific exceptions for, but you can't kind of keep taking them, too regularly.
Right.
They may be certain types of drugs that are not really supported on a regular basis. However, yes, we'll support you with the drug exception process and provide you with all the necessary instructions that you need.
Okay, thank you.
No worries, Marianne. Aman?
Hi, good morning. Am I audible?
Hello?
Hello, am I audible?
Yes, I can hear you, yes.
Yeah, so I wanted to ask a question regarding international students. So I have applied for my Alberta Health Services card, and they're saying that I will receive the card in around 2 months or 3 months.
Okay.
So how can I go to the dentist or go to a doctor before that time period, or do I have to wait for my Alberta Health Services card before I apply for these services?
So first of all, the plan will cover you for any service days that you incur between September 1st, 2021 and August 31st, 2022. Now, if you do not have a provincial healthcare card quite yet, you're able to hold on to those expenses and then claim for them after. They will still be covered under the plan. The only difference is that you would have to actually incur the cost and then claim for it after. I believe there is a temporary, there should be a temporary equivalent basic provincial health care that you can actually access within the time that you're waiting for the Alberta health card. However, I would have to look into that, and we'll provide that information through the GSA a little bit later. But yes, you will still be covered for that service. It's just that you may have to wait a little bit before you can actually submit that claim to the insurer. But be rest assured that you won't be left high and dry with that expense when you incur the expense. You should be covered for that expense for sure.
Okay, thank you.
No worries, Atika, I think, yes.
Sorry, I think I might have missed it, but did you mention that we could use, I guess, like our student Alberta health plan anywhere in Canada, or is it strictly just in Alberta?
You can use it anywhere in Alberta. So sorry, anywhere in Canada. Sorry, my bad.
Okay.
So when you have when you find yourself in Ontario or in Alberta or in Saskatchewan or in BC, wherever you may be, that healthcare is accessible. And you can submit claims wherever you are as well. So your Pay Direct card should be accessible to you anywhere in Canada. You can submit that to any pharmacy that you go to, and if they can do direct billing, they should be able to bill you for the portion of the plan.
Perfect. Thank you so much.
No worries. Let me see how the chat box is doing.
Very active, Wally.
Okay, good.
I'm trying. Sorry?
Am I missing any questions in the chat box?
I'm tackling them one after the other. So if you have answered all in-person questions, then we can verbally get to the chat questions.
Okay.
Did we answer the question from MR yet?
I've not answered all the questions in the chat yet. I'm still tackling them. So
okay.
Oh, sorry. I just saw MR has his hands up, but I thought it's not there anymore. Okay.
Okay. I think I answered the question. Okay. So
how about Eric Wu?
Yeah, I have a question for you, Wally.
Okay, hi Eric.
Yeah, hi Wally. So thank you for your presentation, and also thank you to Ali for answering my question in the chat box. Just some clarifications I wanted to make was, I noticed that on the GSA Health and Dental website, that the courier number has changed to 51.
Yes.
And I was wondering what that means.
Yes.
And how it would be included in the claims for drug prescriptions or for dental, for instance.
Yes. So that courier number, do you remember when I talked about how Desjardins has expanded their systems to now include being able to submit direct claims for all practitioners, most practitioners at least, so like physiotherapists, podiatrists, and other practitioners.
Right.
That's part of that change. So that courier number 51 is a new addition to the Pay Direct card. So all that it affects really is your Pay Direct card. So when you present the old Pay Direct card at a pharmacy, they might not be able to bill you because the whole system has changed now. So you just need to download the new Pay Direct card on the mobile app, if you have the mobile app, or on the website if you have the website. So you just submit this to the provider. And I know some of you will probably go to the pharmacy and maybe provide them with the old Pay Direct card, and they might not be able to bill you. However, if you do present them with a new Pay Direct card with the courier number 51, they should be able to just rebill you as they usually would. And it's just part of the expansion in the Desjardins system. So that was just the only change that happened with the Pay Direct card. So this shouldn't affect your paper claims or your the claims that you send directly to the insurer via the mobile app. This just affects your Pay Direct card. So please ensure to download the new Pay Direct card so you don't have too many issues when you go to the pharmacies.
Okay, that's great. Thanks, Wally. And I have a second question as well. My second question is about Azure Insurance. I'm not sure if you've heard about that.
Sure. Yes. This is. I think this is the. Yes, I have.
Oh, okay. I was wondering how it works because I understand that my plan is still insured by Desjardins. So would Azure Insurance basically just be a partner with Desjardins right now then?
I believe so. I believe it's.
Okay.
I believe Desjardins could be just under. They could just be under one umbrella.
Okay.
The insurer is still Desjardins. It's still they. Don't worry about the insurer.
Oh, okay. I see. Oh, okay.
Yeah.
Sounds good. Okay, thank you, Wally.
No worries, for sure.
I have a few questions that we received earlier from social media. Maybe I can just ask here.
Yes, Mary. I was actually going to ask you about those, Mary.
Yeah, we have a question asking how can I coordinate my benefits with my employer's benefits?
Yes, I believe we have a detailed step-by-step instruction on how to do that on the website. I'll get Ali to drop that in the chat box. However, I can just go over it real quick. Please note that if you do have coverage to the GSA Health and Dental Plan, it is your primary insurer. So, oh yes, thank you, Rachel, for dropping the link as well. But this is your primary insurer, so it means you have to submit all your claims to Studentcare, to Desjardins first. So under your GSA Health and Dental Plan with the group number and your member ID, submit that claim to the insurer. They will send you your reimbursement and a claim statement that you can access if you do have access to the online Desjardins account, or they can send you a paper form of the EOB. So the EOB is called the explanation of benefits. When you have this claim statement, the explanation of benefits, you can then submit this to your secondary insurer so they can pay out the rest of the insured portion that wasn't covered by the GSA Health and Dental Plan. So that's just in summary. You don't have to remember everything I just said, but it's just a step-by-step on how it works. But there's a detailed explanation on how to coordinate your benefits with your insurer and how to submit claims to your primary and secondary insurer in the chat box below. Thank you, Rachel, for that.
Thanks so much. I see we have more hands up right now. Mariana, I'm not sure if you have a follow-up question.
I don't. Sorry.
Okay. Oh, no worries. All good. Thank you. And now we have
Neka.
Neka. Yeah.
Hi, Neka.
Hi, Wally. Thank you.
No worries.
I joined late, so about that. But I don't know if this has been covered for a student who wants to add a dependent and a dependent. How much does that cost? And is it cover for a year as well?
Yes, so we do have a change of coverage period where you can make changes to your plan, and you can decide to add your spouse or your child. Parents are not usually eligible for the as dependents under the plan. So this change of coverage period is from August 27th to September 24th, 2021. So right now it's actually in progress. So when you go on our website, studentcare.ca, you will see a part on the right-hand side saying couple and family enrollment. When you click that and click on the left-hand side that says enroll your family now, it will take you to a coverage manager where you can make all those changes, add your dependent under the plan, and it costs the same as it costs you in your tuition fee statement. So basically, for the health and dental plan, you get charged $579, I believe, in your tuition fee statement. That's the same amount that it costs you to enroll your family as well. So for one dependent, it'll be $579. However, if you do want to enroll 2 or more dependents, then you pay $1,035 for the whole year, I believe. So yes, you can definitely add your dependents under the plan. I believe it's been added to the chat box already for adding dependents. And if you go just scroll up on the chat box a little bit, you should see the couple and family, the link to the couple and family enrollment platform.
Okay, okay. I'll look out for that. And one more question: is it immediate? Like, does the cover start immediately? Like for us who are beginning this fall term?
Yes. So yes, you will have you get the minute you pay for the plan. Actually, as you build the plan fees in your tuition fee statements, you're already covered for coverage from September 1st on to August 31st, 2021. When you do add your dependents into the plan, it takes a while for us to get that information, and update that information with the insurer Desjardins. However, please know that all your claims will be retroactive to September 1st, 2021, which means you are covered from September 1st, 2021, regardless. Even if you haven't completed that enrollment by now, when you do complete the enrollment, your activation will be retroactive. So we'll just backdate the dates that you're eligible for reimbursement for. So you can submit all your claims with service dates from September 1st onwards.
Okay, and then finally, up to what percent? I'm sure I'll get this information when I look at the link. But does it cover things like IUD, family planning?
Yes, it does. So the plan covers hormonal and non-hormonal IUDs as well. For the percentages, for certain medications like IUDs and other medical equipment, you'd have to email Studentcare with a DIN number or the actual detailed digital product information, and then we'll look into that information with the insurer and provide you with all the coverage information about that particular medication or medical equipment. So yes, please reach out to us at services@studentcare.net or through our chat box on our website, and we'll be able to look into that information with the insurer for you.
Okay. I will send email to services at Studentcare.
Yes, service@studentcare.net. I'll just
Service at Studentcare.net. Okay. Thank you.
No worries.
Thanks. I have a question here asking, I'm new to the plan and paid my fees. Why I'm coming up as not active?
Oh, okay. So if you're new to the plan, in September, please be advised that we do have a blackout period. And it's not as scary as it sounds, I promise, guys. The blackout period is a period where, because you're new to the plan, it takes just maybe a couple of weeks for us to get that information from the university, because they bill you in their tuition fee statement. We get that information from the university and we transmit that information to Desjardins, your insurer, so they can just synchronize the information on their end, our end, and the university's end. When that happens, you might not come up as covered immediately, but the way to verify that you're actually covered under the plan is to just check your tuition fee statements. If you're a full-time student and your tuition fee statement says that you have the health and dental coverage, it might take a couple of weeks, about 3 to 6 weeks, to be actually active on Desjardins' end. However, when you do get on Desjardins' end, everything that you do incur between September 1st and that time will still be reimbursed. So you might just not be able to get billed directly at the pharmacy or at the dental office or the physiotherapist office. However, that coverage will still apply when you do get active on their end. So it will just be retroactively backdated up to September 1st, 2021.
Awesome. Next question is on, can I opt out if I'm studying online outside of Canada?
Yeah, so we're coming up with a policy surrounding students who still choose to stay outside Canada and continue their studies. Obviously, because COVID kind of came up with a lot of uncertainties. So we're still kind of coming up with a policy regarding that. And within the next few days, I believe we will provide the association and students in general with some information about the policy surrounding opt-outs for students who are not in Canada and are still full-time students at the University of Calgary. So please just keep an eye out on our website. We'll make sure to provide you with all the information regarding those particular students, and we'll make sure we do everything to accommodate the opt-outs and the opt-out requests if we do proceed in that manner.
Awesome. Next question is, how do I claim the consultation fees beforehand? He didn't provide more details on the consultation fee, but maybe you have more idea on that.
I'm thinking in my head that he might be talking about just to see a doctor. So, for example, if you're feeling a little bit ill and you go see a doctor, please note that this is where the provincial healthcare comes into play. So, just to go see a doctor just because you're not feeling very well or you just had some issues, that fee is actually covered under your provincial healthcare. So whether it's your OHIP or your AHIP, that's what will cover you for that expense. The GSA Health and Dental Plan is an extended benefit that will cover you for extended medically necessary services. So if he meant just a consultation at the doctor's office, it will be covered under your provincial healthcare. So AHIP will cover that. Your health card will cover that. However, anything after that, so if they prescribe anything that you need to do, like if you need to go to see a physiotherapist, or you need massage, or you need prescription medications, then we would come into play in that regard.
Awesome. The next question is, are there any extra resources where I can get more mental health assistance?
We do. I think we work with with a lot of we have psychology benefits under the GSA Health and Dental Plan. I know there are also some resources on campus that you can actually go to and get some mental health assistance as well. We do have a service called Empower Me, but please give me some time to just look into the Empower Me details, and then we'll provide you with more information about that through the GSA website or through the Studentcare website as well. I'm just trying to be careful so I don't feed you with any information that is incorrect right now. But we do have a lot of resources for mental health.
Wally, would you like me to touch on Empower Me?
Yes, touch on Empower Me, yes.
Yeah, so Empower Me is a mental health service that is available to GSA members. It is free of charge, and it is available to you 24/7, 365 days a year, you do not have to pay anything in order to meet a counselor. So at any time during the year, if you are feeling distressed or you are feeling, if you're feeling low, stressed, anxious, depressed, stressed during exam times particularly, feel free to call Empower Me, and I am going to drop a number of that in the chat. In fact, I'm going to drop a link in the chat box. You will be able to, thank you. Rachel is way ahead of me. If you go to that link over here, you will see a phone number. Feel free to call that number at any time, again, 24/7. You will be paired with a counselor who can best assist you with your particular case. You will be paired with a counselor for anything between 4 to 8 sessions, depending on your particular case and the assessment that you will go through. Also, one thing to note that Empower Me is fully confidential, so whatever you share with your counselor will not be shared with the GSA or will not be shared with Studentcare. So it's just strictly between you and your counselor within legal parameters. And it's also multilingual. So if you prefer to speak to a counselor in a language of your choice other than English, you will be paired with a counselor that can best assist you in your language of choice. So that was my little Empower Me blurb. Back to you, Ole.
Thank you, Ali. Thank you for that. Thank you.
Awesome. Now maybe we could answer some questions from the chat.
Yes. Okay. Let's see the chat box. I hope I'm not missing too much.
I think I finally caught up with all the answers in the chat, but there is one actually really good question that I was asked privately. So I will kind of just generalize it to everyone. As an international student, if your Alberta healthcare has not kicked in yet, and you need to visit a doctor to get a prescription, what other alternative is there to see a doctor?
Oh, let me see. Give me 1 second. Sorry, Ali, can you say that again?
Yeah. So if Alberta healthcare has not kicked in yet, there's a waiting period for students to get their health card, correct?
Right. Yeah.
So in the meantime, if someone needs to visit a doctor and get a prescription, how would they visit a doctor? Would that be through GuardMe? I'm not sure if Calgary, University of Calgary has GuardMe.
Yes, I know. Some other associations have GuardMe and like some basic provincial healthcare equivalent programs. However, I'm not sure if the I don't know if Mary knows this, if the Calgary GSA has. Okay, you might not be able to get an equivalent coverage right at the start. However, please note that service that you incur in September is still eligible for coverage. You might not be able to get it's going to be basically like the blackout period for you as well, unfortunately. So however, just note that your claims will still be processed by Desjardins, your insurer. So hold on to your receipts if you do go incur any eligible services under the plan and you can't access benefits because of the wait period. If you have a wait period to get your health card, please note that you will still be covered for that expense, probably just not at that particular time. But please just hold into your services, hold into your service receipts, and submit all your documents via the mobile app or via the paper claim forms on our website, studentcare.ca. So you'll be covered for that service eventually, for sure.
Yeah, I am on the University of Calgary website, and I don't see a mention of GuardMe. So I would advise the individual to contact International Services for Students, and they will be able to help you out. I can't recall if there is a health clinic on campus. If there are doctors on campus, then that might be an alternative for you to get a prescription from them, because then you will not be charged in that case.
Yeah.
But the individual in question does need a prescription ASAP. And so, that's one of the issues. I guess the other follow-up question to that would be, would a prescription from a doctor from the home country work here?
I don't think
that's what I thought.
So unfortunately, that won't work in Canada. So you would need to see a Canadian registered and licensed doctor to get a prescription, because then Desjardins, the insurer, can actually check the credentials and actually verify the credentials a little easier. So it's advisable to actually get that prescription from somebody within Canada, a doctor within Canada, before actually incurring your service.
Awesome. Paris is asking in the chat if these slides will be available to you later on. We can definitely send this over to the GSA.
Yes.
You know, we'll PDF it and send it. Yeah.
Yes, we'll do that.
Someone's asking if they don't have an address in Canada yet, are they able to enroll in Alberta healthcare, or do I need to get an address first?
I believe one of the requirements to get to be enrolled under the Alberta Health Care Insurance Plan is you have to actually stay in Alberta. You have to prove that you're a resident of Alberta, I believe. So you would need to actually be in the province before you can apply for your health card and to register for your health card.
That's right. Let's see. Is there any other question?
We have a hands up, Jamie.
Okay. Hi, Jamie.
Hi, Wole. I just have a question. I would like to know if there is always an out-of-pocket portion that I have to pay, even if I go to any network provider.
Yes, and that will depend on what kind of service you're going for. For example, if you go for a cleaning, a cleaning will cover you for 70% of the plan, of the insured portions of the plan. And then if you go to see a network, for example, you get covered for 70%, and then they give you another 30% in additional discount. So you won't have to pay anything. However, if you go for something like a crown, for example, if you incur a crown service under the dental portion of the plan, it will cover you for 50%, the network covers you for 30%, and then you have to pay for the rest of the 20% by yourself. So different services call for different network discounts. So yeah, it just always depends on the service that you incur. So some of them you won't have to pay an extra copay as a student, but for others you will have to pay a copay.
Okay, and in that case, do I have to file the claim, or the provider does it?
It's already, the minute if you have your pay direct card, if you go to see the provider, the claim is processed at the pharmacy or at the dental office. So if you show them your pay direct card, they bill you the insured portion of the plan. So they just bill you automatically, and then you just have to pay the rest of it. So you don't have to submit a claim after that. So all you will be asked to pay there is probably just the 20%. For example, if you do the crown and you get charged $100, $50 is covered by the plan, another $30 is covered in network discounts, you'll be asked to pay $20.
Okay.
Yes.
Okay. Thank you very much.
No worries. Sure. Oh, I think, Aman has a question.
Yeah, regarding the pay direct card.
Yes.
Am I audible? So is that card activated as of right now, or do we have to wait for the blackout period to end and then we can activate the card?
Yes. So if you don't have to even do anything with the card really. If you're a new student in September and you build a plan using your tuition fee statement after the blackout period, so after that 6-week period, that plan will be automatically activated. So you'd be able to go to the pharmacy and show them that card, and they'll just be able to directly bill the insured portion of the plan fee. So you don't have to activate it. However, it won't be activated right away. You'd have to wait until we can get your information from the university and update that with the insurer as well.
So if I go to a dentist today and I apply for that card, the card won't work right now. It will work after 6 weeks.
Yes, it will work after 6 weeks. That's correct. That's correct. If you're a new student, it only doesn't affect students who have been under the plan for the past year. So, for example, if you do, like, if after this coverage period is over in August 31st, 2021, when you start school in September, you won't have to deal with a blackout period. It's just for new students who are starting school in September for the first time. Understood. Thank you. Yes, no worries. Sure. So I think there's a question in the chat box as well. So as part of my 14-day quarantine, I'm not entirely sure. Unfortunately, I'm not sure if you have to do that. I believe you can. I think Rachel dropped the link to the AHIP website where you can actually check their frequently asked questions and probably just email or contact there. I'm not very well versed on the AHIP coverage. I only know things about the GSA health and dental plan, unfortunately. if you have any more questions, please let me know so I can address your questions. I mean, if you don't have any questions for right now, that's okay too. We can definitely redirect you to our contact center on our website as well. How do we register for direct deposit? You can do this on the mobile app, and also you can do this through the Desjardins online account. All the information about that is available on our website as well. To download the mobile app, I think you just have to go, just look for Studentcare mobile app on the App Store. If you have an Apple device, or the Play Store if you have an Android device. It gives you the option to register your direct deposit information. Yes, I can do that for sure, Neka. So when you have your mobile app, you can just access your direct deposit information in there, update your bank account number and your just your information. Then the insurer will be able to just reimburse every claim in that way.
There's another question asking, can you confirm the policy and certificate numbers?
Sorry, Mary, say that.
Another question asking, can you confirm the policy and certificate numbers?
I believe it's Q1204, but let me confirm.
Wale, may I make a suggestion?
Yes.
I found that it's helpful, considering the questions that we're getting in the chat box, to just do a very quick demo of the website.
Oh, yes.
Because all the information is literally on the website. So it would just be easier to share your screen and show people where that information is on the website, rather than sharing endless links, which can be confusing in the chat box. So yeah.
Okay, I'm just going to share my screen right away. Just give me just a quick second. Okay. So share screen. Okay, can everyone see my screen? Yeah, okay, great. So I'm just going to go back here. 1 second. Okay, wait a second. So just give me a second. I'm just going to, okay, move to button. Here we go. Okay. So when you hit studentcare.ca, can everyone still see my screen?
Yep, all good.
Great. So when you hit studentcare.ca, you'll be asked to put in your association information right here. And so what you want to do is just hit GSA and scroll all the way to the bottom, and you see the University of Calgary GSA. So this page has all of the information that you require as a GSA member under the health and dental plan. So on the right-hand side here, if at the bottom, this is what I meant. You have the opt-out tab, you have the change of coverage tab, the self-enrollment tab if you're not automatically billed. For students who are not automatically billed the plan fees, you're most likely a distance education student, a part-time student, a visiting student, but all full-time students are automatically enrolled under the plan. So we have all of the information here. For the Pay Direct card, this is where you go in the download center of the Studentcare website. Just hit the Pay Direct card. You will find it right here as a PDF file. And the Pay Direct card already contains the information in your group number. So the carrier number is 51, your group number is Q1204. You put your 8-digit student ID here, which will serve as your plan number. So you'll be 0 right behind your 8-digit number. So this is all the information that your pharmacist or your dental office requires in order to actually direct bill you the insured portion of the plan fees of the plan. So there's all the information that you would need to know about what is covered under the health plan is right here. We have the dental coverage as well. We have the vision coverage, the travel coverage, Empower Me. So we do have a lot of information that help under the Studentcare website for sure. So if you do have a minute or two, please visit the website, see everything that you're covered under, and yes. So this is what the website looks like. This is how to access it. It's not very complicated at all.
Lots of questions on the networks as well. If you wanna just do a demo on that.
The good thing about the network is that on every single page that you visit, the network kind of remains on the right-hand side. So you can select the Studentcare network here for either dental, vision, chiropractor, massage therapy, physiotherapy, psychology. If you hit the dental network, for example, you're allowed to search by campus, by neighborhood, or by city, by address, by professional name. So if you want to check if a professional that you actually go to regularly is covered in the Studentcare network, you can actually do that by checking the name or by using your address, so you can see the one that's most closest to you, or by the city or neighborhood. So Alberta, Calgary is what you click and see which one is closest to you. So for most of the services, we do have a list of exclusive networks that you can just search by checking. Even the complete network list, you can see a list of every single network under the plan. And yes, so there's an updated list on our website. So please feel free to visit that website, and yes, you'll be able to access the network list for sure. I'm going to stop sharing my screen.
Wait, before you do that, can you also show up the policy number and the certificate number, which is just there it is.
So the policy number is, you see the place here under the claim section where it says group numbers. It shows that for your health, dental, and vision coverage, your group number is Q1204. Yes, I was right. And then the insurer is Desjardins Insurance. You have your travel coverage as well, which is a different group number than your health, dental, vision. It's 9710180, and it's administered by Blue Cross. So yes, so this has all the information that you need about your health, dental, and vision coverage, and your travel coverage as well. On the Pay Direct card, it has that information as well. So for if you want to get your prescriptions filled out, or your dental coverage directly billed by the dentist, you can also have that information on the Pay Direct card. So the only part you really have to fill out is your name and the student ID. All the other parts are what your provider will require in order to directly bill you at the point of service.
Thank you so much, Wole. That makes it a lot easier with the questions in the chat.
No, thank you.
I believe I have caught up with all the questions in the chat. So if there are any more questions, please, I'm also mindful of time, Mary. So if we are going over time, please just stop us.
Yeah, thanks so much for being here today. We're actually 3 minutes over time. So if anyone has any follow-up question or another question, please send a direct email to Studentcare, and they will handle it perfectly. I just want to thank everyone for being here today, and make sure you get a screenshot for your GSA bingo test. And we look forward to see you around campus. Thanks so much, everyone.
Thank you. Thank you.
Thanks, Wole, Ali.
Take care, guys.
Thank you. Good luck, everyone.
Bye.
Bye.